One of the tricky things about properly diagnosing adrenal disease is that a lot of the adrenal disease symptoms are very similar. They may be entirely different conditions. However, there are some overlapping symptoms that make it challenging to decipher what is what condition. Now, there's some things that are very specific to each individual disease. However, this consistency of some of the same symptoms makes it really challenging. And that goes for a lot of chronic illnesses or invisible illnesses or autoimmune diseases. So many of the symptoms are incredibly similar, making it very challenging for the individual to figure out what's going on, let alone a medical team. So some of the symptoms, and I bunched them all together, of adrenal disease, and I've made my little list, but is low or high blood pressure, fatigue, weakness, abdominal pain, salt craving, irritability, muscle weakness and muscle loss, anxiety, depression, darkening of the skin, headaches, weight gain or weight loss, flushing, excessive hunger, water or electrolyte imbalance, dehydration, heart palpitations, nausea, dizziness, tremors, numbness, loss of appetite, vomiting, diarrhea, intestinal discomfort, change in behavior or thinking ability, excess sweating, reduced sex drive, and fainting. Now, as I said before, this is all of the symptoms of adrenal disease clumped in together, but that is because so many of them are very, very similar. And fatigue and weakness and irritability, anxiety and depression, those all coincide everywhere in these adrenal disease categories because our adrenals affect those so severely. So no matter the condition, we're going to be experiencing those and many of these other symptoms. And it makes it really, really challenging to figure out what's going on in the body. Now, all of these symptoms also manifest a little different for each individual person, and what may be for one person may be experiencing, another individual may not. Now, for my personal experience with Addison's disease, I do experience quite a few of the typical Addison's disease symptoms prior to my diagnosis, including darkening skin. I was almost entirely orange. If you look back at pictures of me from 2016, I was just neon orange. It almost looked like I was self-tanning or something. So darkening of skin, depression, anxiety, irritability, excessive weight loss, those were all things that I was experiencing. However, it's really hard to know what's going on with your body when you don't realize that something's really wrong. Our bodies are designed to work properly and to feel great. And if they don't, we don't always cognitively recognize that something's off. But, our body is a machine. It should be properly going. If there's one thing out of order, there's going to be a chain reaction that's going to mess everything up. However, if you are not sufficiently educated on your machine or understanding each individual part and how it comes into play with everything else, you don't really know what you're looking for. So having symptoms, sometimes you disregard or you downplay because you don't really understand that maybe they're a missing puzzle piece to other things that can coincide together and help you figure out what's really going on for you. So symptoms vary, but my number one recommendation if someone is trying to crack their own body's code to figure out what's going on with their symptoms or with their organs or diseases is to keep a diligent journal of your symptoms. And I'm talking diligent every single day. What's happening when? What did you eat? How did it affect your body? What movement did you do? How did you sleep? Until you start to see a pattern of your symptoms, so that way you are understanding what's happening consistently in your body and you can start to discover what to research or what to ask for from your medical professionals. Because honestly, they aren't always looking at these specific things, because when it's, you're coming into the doctors and you're saying, I'm tired, or I'm not feeling very strong, or I'm feeling a little depressed or a little off, or my stomach doesn't feel very good, the first thought isn't, let's check the adrenal glands. That's just not a common thing that doctors dive into. So it's something that you need to dive into a little bit yourself, and analyzing your body situation and symptoms to know when to ask for adrenal attention, like when to do specific testing on your adrenals. So those are all of the symptoms. And I know there's so many more because everybody experiences so many different things, but these are a compiled list of the types of symptoms that you see with adrenal disease. And as you can tell, none of them are very comfortable or pleasant. But when you're experiencing them and you don't really understand or know anything about the adrenal glands, I can speak for myself, I just felt weak and almost I felt like a baby, like the fact that I'm complaining or upset or feeling insecure about all of these symptoms, because what if everyone else is feeling the same thing and I'm the only one complaining? And that's where my mindset was for a while, until I really learned to understand my body and what it was trying to tell me. And then I could take ownership of like, oh no, I'm not supposed to feel miserable 24/7. The body is not designed for that. So taking note of your symptoms is essential into discovering what's happening in your body. And so this is just a little bit about what those adrenal disease symptoms look like for the body.